Oral mucosa is the first barrier against microorganisms. So, before infecting the respiratory tract, the first stop for any virus is the oral cavity. A systemic disease having oral manifestations is not a new occurrence. Oral manifestations of human immunodeficiency virus are well known. In fact, oral lesions are not all bad. They were found to have diagnostic and prognostic values, meaning they are an important markers of early infection. Detection of oral signs would allow mild to moderate cases to be identified early and the patient can self-isolate early. So this will reduce the spread of the disease to others before RT-PCR testing is done. This is especially beneficial in countries with reduced testing capabilities. To understand why oral manifestations occur, we need to see what happens at ground level. We are into the airway now, and this is the airway epithelium. Angiotensin converting enzyme 2 receptors are distributed here.
Enemies ahead!
There comes SARS-CoV-2 virus.
This looks like a good place to rest.
SARS-CoV-2 binds to the angiotensin converting enzyme 2 receptor. After binding, it is taken further inside the cells. Keeping a guest sitting outside is bad manners. That's when the coronavirus shows its true colors. It hijacks the cell's replicating mechanisms and replicates itself. Basically, it creates its own army. Hundreds of newly replicated viruses are released from the cell. Our host cell obviously cannot handle this betrayal and dies. Cell death in certain areas of the airway means that these cells can no longer do their jobs, like removal of mucus, dust, and bacteria, and lubricating the lungs, which can lead to symptoms seen in COVID-19, from cold-like symptoms to respiratory distress. Bad news is, ACE2 receptors are not just in the airway epithelium. They are also present in the cells of the tongue mucosa and salivary glands. So they also might become host cells for the virus. ACE2 expression is even more profound in the gustatory receptors of the tongue than the buccal or gingival tissues. This is one mechanism for the causation of oral manifestations like taste disorders. According to studies, taste disorders are the most common oral signs. The global prevalence of taste disorders in patients with COVID-19 is 45%. Second mechanism is by way of cranial nerves. You see, SARS-CoV-2 virus also affects the peripheral nervous system, and we all know that taste buds are innervated by cranial nerves. So because of the damage from the virus, related functions may be impaired, resulting in taste disorders. Third, SARS-CoV-2 may bind essential salivary mucin components such as sialic acid. This results in taste particle degradation and disturbance of normal taste sensation. Other oral manifestations related to the tongue is geographic tongue. We have all heard the term COVID tongue recently, right? According to the American Academy of Oral Medicine, COVID tongue is an inflammatory disorder that usually appears on the top and sides of the tongue. Affected tongue typically has a depapillated red area of varying sizes that is surrounded by an irregular white border. Because the affected areas on the tongue can change in shape and size, like the continental drift, the disease is commonly referred to as geographic tongue. Geographic tongue is not just related to COVID-19, it can also be due to other diseases. So this oral sign doesn't immediately signify that the patient has COVID-19. But if the geographic tongue is of recent onset, then it could probably signify COVID-19. The reason is the same as taste disorders. ACE2 receptor expression is high in the tongue, as we have just seen. Other oral signs are unexplained ulcers in the oral cavity, desquamative gingivitis, herpetiform ulcers on attached gingiva, petechiae, lichen planus, candidiasis, herpes simplex virus infection, and thrush-like ulcers. The exact cause of ulcers or blisters is not known, and there is a wide difference in opinion. Some studies suggest that the ulceration is a direct result of the SARS-CoV-2 infection, but most of the authors regarded them as aphthous ulcers, secondary to mental stress. SARS-CoV-2 obviously deteriorates the systemic health of the patient, which can have an effect on the oral mucosa. Third reason could be reactivation or new infection by various pathogens like herpes simplex virus. Or it could be due to opportunistic infections due to change in the immunity status of the individual. For example, candidiasis. Intensive drug therapies are used to treat COVID-19 like antiviral drugs. These antiviral drugs can cause certain side effects like stomatitis, oral ulcers, and dry mouth, resulting in frequent oral thrush cases. These oral symptoms can also be linked to the lack of proper oral care and oral examination in a hospital setup, as the priority is to save lives. So the oral health of the patient is neglected. Besides all the causes that we discussed, the oral ulcers can also be the result of vasculitis, meaning inflammation of the blood vessels caused by the excess accumulation of angiotensin II in the vascular cells. Excess accumulation of angiotensin II may cause vasoconstriction, vascular abnormalities, and increased vascular permeability, leading to ulcer formation. A study reported two more rare signs of COVID-19: edema of the tongue and edema of the floor of the mouth. These signs are concerning as they can cause airway compromise. The investigators mentioned that these signs represent rare presentation of COVID-19. As the epithelial cells of the tongue have recently been shown to have high ACE2 receptor numbers, this suggests a possible mechanism for this presentation. So based on what we know till now, we can come to a conclusion that oral signs are an important marker for COVID-19. And these may be the only symptoms a patient may have at that time. So general physicians and dental surgeons must be aware of the oral signs and symptoms of COVID-19, as approximately 80% of the COVID-19 patients are asymptomatic. So guys, I hope you enjoyed this video. Please share it with your friends as it might be helpful for them. And if you haven't already, please subscribe to the channel so that you never miss a video from me.